Endoscopic ultrasound-guided gallbladder drainage as a rescue therapy for unresectable malignant biliary obstruction, a multicenter experience. Introduction. Transpapillary drainage of the bile ducts through endoscopic retrograde cholangiopancreatography, ERCP, is the standard treatment for malignant distal bile duct obstruction. Up to 25% of patients with pancreatic cancer and biliary obstruction have concurrent duodenal stenosis, which makes ERCP challenging and often unsuccessful. Multiple studies have reported the usefulness of endoscopic ultrasound-guided bile duct drainage, EUS-BD, as an alternative treatment to achieve biliary drainage. Although EUS-BD has a high technical success rate and an acceptable risk profile, EUS-BD can fail for multiple reasons. EUS-guided gallbladder drainage, EUS-GBD, commonly used in treating acute cholecystitis in patients who are not surgical candidates, is an attractive salvage therapy when both ERCP and standard EUS-BD techniques are unsuccessful. A previous single-center study reported a clinical success rate of 91% for EUS-GBD in 12 patients who failed ERCP and EUS-BD, with an adverse event rate of 16.7%. The authors aim to assess the effectiveness and safety of EUS-GBD as a rescue therapy for biliary drainage after failed endoscopic interventions for unresectable malignant distal bile duct obstruction. Background. ERCP is often unsuccessful in patients with duodenal stenosis or malignant ampullary infiltration. While EUS-BD has been proposed as an alternative, EUS-GBD is an attractive option when both approaches fail. The authors aim to assess the effectiveness and safety of EUS-GBD as rescue therapy for malignant distal bile duct obstruction. Methods. A multicenter retrospective study was performed on patients with unresectable malignant distal bile duct obstruction who underwent EUS-GBD between 2014 and 2019 after unsuccessful ERCP and EUS-BD. Clinical success was defined as a decrease in serum bilirubin of more than 50% within 2 weeks. Results. 28 patients were included with a lumen-opposing metal stent used in 26 patients and a self-expandable metal stent in 2 patients. The technical success rate was 100%. The clinical success rate was 93%, with an improvement in bilirubin, 7.3 pre-procedure versus 2.8 post-procedure. Delayed adverse events included food impaction of the stent, N = 3, with a further 2 patients developing cholecystitis and bleeding. Conclusion. This study demonstrates the feasibility of gallbladder drainage to relieve malignant distal bile duct obstruction in patients with failed ERCP and EUS-BD.